Welcome everyone to this session with Dr. Irene Hedin. So I'm Dr. Christopher Stoyanowski. I'm a assistant professor at Tulane University and research director of Partners for Advancing Health Equity, where we kind of do workshops like these and synthesize evidence and have some webinars talking about various health equity concepts, work, but also how do we start thinking about that through
Hello, everyone. My name is Dr. Irene Hedin. I am assistant professor at the Drexel Dornsife School of Public Health. I'm in the Department of Community Health and Prevention, and my work broadly focuses on neighborhood environment, structural racism, and how the intersection of the two produce racial inequities in maternal health outcomes. But specifically over the last few years, I've been developing my use of and learning about community-based system dynamics as a tool to actually model the problem as a systems problem, right? So we talk about structural racism. And oftentimes, I'm trained as an epidemiologist, so oftentimes we try to pull things apart and find the independent association or independent effect of this piece of structural racism on outcome, whatever, where it really is this interconnection and feedback that matters. So that's really the kind of rooting and training that I've been incorporating into both my epidemiology and applied work and doing this work in Philly. That is not the topic of today, but if anyone has questions about how that work is evolving, and really part of the work that'll come in the next two sprints is going to also be informed by just lessons learned from doing this on the ground. Please just let me reach out to me. You should have my contact information. I'd be happy to chat. So today we will be, there we go. Starting out the first of three different kind of learning sprints on community-based system dynamics, specifically with an eye toward its use in health equity challenges. And the process, or kind of the arc of these sessions, are going to be first learning. So we're going to do today, it's going to be a little bit lecture heavy. It's going to be around introduction to community-based system dynamics, and that's the CBSD acronym. And then we're going to get into the first step and foundational element of problem definition for system dynamics and community-based system dynamics problems. Then once there's going to be homework in between session 1 and session 2. So apologies for kind of throwing you back to your kind of college, high school days of having homework between sessions. If you're, if that's been in your past, as it has for me, but there'll be homework between the two sessions to kind of skill build based off of the learnings that we have today. And then next month we'll have session 2, which is really transitioning us more into discussing how the use of these tools and how they can be used in your particular context to understand a systems approach to solving or understanding whatever a health equity problem is at hand. We'll be specifically focusing on what are called scripts. And you'll learn what these things are, but they're kind of facilitation tools for implementing these approaches in session 2. And we'll talk about design considerations which both are anchored and yet go beyond just core system dynamics or participatory system dynamics tools. So we really be getting into that and then transitioning into discussing what they mean and implications for them for your contexts. And then in session 3, we'll actually be transitioning as best we can to starting to create around or based on kind of these principles of both system dynamics and community-based system dynamics. So you will be tasked with bringing your own problem to work. So basically with that in mind, as we're kind of working on these first two workshop sprints, start to think about like, how does this apply if you already have a problem in mind or want to find one in the news or outside or in the world around you, or if you have one that you want to start to develop. That session 3 will really work towards you being able to start to workshop your problem, understand if it's dynamic, and understand how you might start to transition it to a community-based system dynamics context. Now, that being said, and I'll get into learning objectives in a moment, but uh, learning community-based system dynamics is it's kind of a lot high learning curve. So these 3 session sprints will almost be kind of a teaser for you to go on and continue your training or continue your exploration of this tool and its use within health equity kind of problems and challenges. So at the end, I'll also provide kind of a resource list of other places you can continue to develop your capabilities in this area. But I want to preface it with saying that, it's just a teaser because I found that the way to learn these methods is really iteratively applying them. And so it may at first seem like things are more complicated and more kind of muddy than they were at the beginning, but that's really part of the process of learning how to switch our mindsets from a linear mindset or just our conventional way of understanding problems to these system-based approaches, especially and how we work with them in community to kind of build some consensus around systems approaches to solving equity issues. So that's kind of the caveat with the arc of where you'll end up after the arc of these learning sprints. So the objectives of the course are as follows, and you can always revisit these slides to understand whether you want to go deeper or kind of if where kind of you're feeling maybe learning gaps with regards to the objectives, but they are to understand CBSD and its relationship to other methods of system science, system thinking, and system dynamics. So it's one particular approach within a larger umbrella or kind of one tool within a larger toolbox of systems approaches. You'll also be able to identify and define problems that are most appropriate for CBSD. You'll be able to learn, or hopefully you'll learn to utilize best practices to design a community-based participatory workshop, identify facilitation strategies and scripts to enhance group-based participatory experiences, understand how to use resources such as Scriptopedia in a workshop design, and be able to utilize causal loop diagrams as a tool to discuss and illustrate system behavior. And if a large majority of that is jargon right now, by the end of the course, hopefully the sprints, you'll be able to revisit these and have a clarity around what may seem to be jargon right now. So those are the learning objectives. But before getting into learning, if you can use the QR code here to take you to a poll EV environment and answer the question of, in one word, what interests you, and the what is not there, but what interests you about system dynamics? And it can be from any perspective that you're thinking about, whether this is like an addition to an already started learning arc, or if this is your very first kind of engagement with system dynamics and community-based system dynamics, just put one word that comes up for you around your interest in system dynamics and coming to this course. So we'll take maybe 2 minutes. And as one might expect, complexity and community engagement are right here at the center of the Wordle. But also there's a lot of, actually there's one over here, reality, or solve, I don't know if these are together, solving reality, but they look to be together to me, which I think is an interesting perspective to bring because, right, one of the things that is kind of interesting and useful about these systems tools is that it allows us to bridge across different realities that are equally true, but maybe differently experienced, that are contributing to that complexity that we experience and how we then can work toward new solutions, which I really like that being in the Wordle. To community rooted problems. Ooh, I also like the word ecosystem. Fun fact. So this is a little bit of a tangent, and I'll do brief tangent and then get back. But the origins of system dynamics in general is actually outside of the health field, although there have been really excellent and interesting applications in the health field. But one of the biggest applications outside of the health field was actually with regards to ecology and climate and environment. So those are clear systems of operation in which many of these methods have started to evolve. And so really thinking about ecosystems, not just from the origins of this method, but also how do we start to think about our own environments and communities that we're operating within as ecosystems that we can then build up and make sure that they're sustainable rather than kind of crashing as we might see in when we don't acknowledge the system's perspective. So, all right, the final thing I'll say is I love this word here at the bottom around intersectionality. I think that's a really huge benefit of these community engaged and community based applications of system dynamics, because they can work within contexts where intersectionality exists, which is again most contexts, but that is one of the strengths of applying these methods. So thank you all for participating in this Wordle. And also you can see kind of how people in the room are also relating to their interests in system dynamics. So, all right. So before we get into kind of the lecture content and all of that, because we are in a space where we're going to be talking about health equity, which the fact that we don't have health equity achieved is a product of ongoing structural marginalization, of which many of us are positioned differently within these systems of marginalization. I want to set a kind of set of group agreements for how we engage in this space. And this is really to ensure that it's inclusive and people feel supported learning in this space, and especially around kind of challenging topics that might come up as we're understanding and exploring and engaging with the examples that relate to applying this to health equity challenges. So hopefully, well, no, I won't say hopefully many of you have seen this. I'll just say these are the group agreements that I like to center in my work, both within when I'm doing community engaged work, as well as when I'm doing just, operating within my research group, right? So they are as follows: to try it on, be willing to try on new ideas and different ways of doing things. Intent does not equal impact. Try to understand and acknowledge the actual impact that your words or your actions are having. Denying the impact of something said by focusing on its intent can be more destructive than the initial interaction. Practice mindful listening, trying to avoid planning what you'll say as you listen to others. Practice self-focus. Attend to and speak from your own experiences and responses, and try to avoid first speaking about whole groups or expressing assumptions about experience of others where you may not be positioned to understand the nuances of that experience necessarily. Practice both and. So instead of, often we're trained to say so-and-so, but so-and-so may also exist. And really this is a practice of substituting, saying X, Y, Z, and this other reality may also exist. And I think this is particularly important for these contexts because it expands the lens and space of reality for both things being true. And also move up, move back. If you are someone who speaks a lot, maybe pause before speaking. And if you are someone who speaks less, definitely, we encourage you to speak up. And it could be either verbally or it can be in the chat. And as a note, I'll be pausing for questions intermittently between our over the course of the next hour and, well, a little less than an hour and 15 minutes now. Um, and you're welcome to, I think people should have the raise hand function. So raise your hand and ask a question. However, if you feel more comfortable putting a question in the chat, we encourage that definitely. Just feel free to present or participate in ways that are comfortable to you. So that's my caveat on move up and move back as someone who's sometimes been less bold about speaking in large spaces. So those are the group agreements that I hope we can all kind of hold with us as we're on this, on the learning journey across these three workshop sprints. So to dive in, so system science is for problems of health equity. They can be particularly challenging to solve with linear approaches. And this slide is a little bit busy, but I want to start out by just focusing on the fact that when we're talking about health equity, often we're talking about problems that we implemented in an intervention and it actually had unanticipated consequences, or we've been working on multiple different policy solutions, and yet we're not seeing a change in the magnitude of those health inequities that we're seeing, or the populations that are disproportionately are impacted. And when we're in these contexts of health equity, where there's a lot of what we call policy resistance, as well as lack of change over time and unanticipated consequences, that may be a harbinger of it's actually a complex system that we're working in rather than a complicated system that we're working in that just requires understanding more and more detail about the problem. And I'd like to present these two different heuristics about the difference between complicated problems and complex problems as an anchor for our conversation, because complicated problems can involve many moving parts, have a high level of detail, but when we understand all of the parts and all of the connections and level of detail, we're able to understand the outcome as a sum of those parts, right? So there are some public health problems that, again, we have a lot of moving parts. We may need to bring together biosciences, virology, marketing, all of that kind of stuff to actually understand the problem and how they work together. But once we understand that, we may be able to effectively impact the outcome because it's the sum of those parts. Here I have an example of a watch, because a watch is a very intricate and detailed thing where there's all these little gears, all these little screws. And if you're missing one, you may have unanticipated outcomes of the watch not telling time, but it really is more about going in and seeing which screw is missing, which part isn't working quite together. And once you actually understand that, while it's complicated, and I know for sure I couldn't go into a watch and do this, once you actually understand that, you can then achieve the expected outcome of the watch telling time. However, a complex problem involves multiple moving parts that are interrelated and interdependent with, i.e. meaning there's feedback between part A and part B with each other. And the outcome is greater than or less than the sum of its parts. And so I'm located in Philadelphia, and we just got on the other side of the long-lasting impacts of Hurricane Ophelia. A hurricane is a great example of this, right? It has a lot of moving parts. It has air particles, water particles, wind speeds, pressure systems, and all of that. And whether it's over water or over land, and all of those particles, or all of those factors, work together to create a weather system. But we can't necessarily say, if we measured all of those things absolutely correctly, that we would understand how certain hurricanes were then going to operate over time, right? It's actually the fact that the pressure can change the interaction between water and air molecules. The amount of humidity or water accumulated within a hurricane can change the wind speeds and how it's operating, whether it's over land or over water, right? And so even if we know all of those things, the operating of a hurricane is more than those some of those parts. And so, for example, in the context of Hurricane Ophelia, that created our predictions around where it would, you know, hit land, which was in North Carolina, a little bit off, right? And so we actually had to update predictions on the impacts of Hurricane Ophelia as we understood the history of its functioning and the interaction of all the different parts by observing it, right? So that's a complex problem. It's more than the sum of its parts. And so to translate that to the health equity context, and also just like to wrap that back into the systems approach, right? When we have complex problems, systems approaches are excellent tools to unpack that complexity, and especially in the context of health inequities, right? So it may not be a hurricane, but we do have a whole range of different factors, and also, all of these factors could be subsystems within themselves, all kind of intertwined in what can seem like a kind of complicated yarn of things that we're trying to pull the thread on to understand, to eliminate these health inequities. And so if we're trying to understand these interrelationships, really it's a systems approach that's going to help us untwine that ball of thread. And before we get into how the tools that we're going to start to learn about over the next three learning sprints allow us to unravel that ball of yarn, I first want to pause for a definition. I always take definition breaks in my lectures because I like to anchor us in the same kind of assumptions about what we're learning about and where we're going on our learning journey. So when I say a system, what I mean is that it's a set of individual elements or things that are interconnected in a way that produces a pattern of behavior over time. And so for that, that means that there are individual elements. So pieces are parts of a particular thing or problem that we're looking at. B, there's interconnectedness and interaction. So by nature, these things don't operate independently of each other. And there's a purpose, function, or goal of the system that we can either understand from the fact that we set that goal or purpose, or we can understand through observing that behavior over time. And so it's really all three of these things that make up a system, which I think will become important to return to when we're thinking about problem definition, because this kind of idea of a system really needs to have a purpose, function, or goal. It's critical to clear problem definition. If it doesn't have a goal or has random activity or outcomes, then it's not really a system, and it may not be a problem that's ideal for systems approaches or system dynamics. All right. So that is the systems approach, complexity, and what a system is. Now, the tools that we're basically going to start to leverage to start to pull apart and understand systems are switching our mindsets to amplify these kind of patterns of thinking and ways of seeing and basically intervening that amplify all of the kind of elements that are on the right side of this kind of box. So the tools that we're going to be using are really designed to start to shift our increasing understanding of problems, interconnectedness, to start to increase our understanding of the wholeness of a problem rather than kind of separating out the parts, to increase our understanding of circular behavior rather than linear behavior, and the way that this interconnectedness and circularity can create a synthesis between parts rather than analysis, which is understanding the operating of different parts. One of the biggest things that I think are kind of a core tool of systems thinking are switching from a siloed mindset to a mindset of emergence. So understanding that once we understand how all the parts work together, there's emergent behavior that we actually functionally can't observe unless we understand how all the parts are working together and interacting. And finally, relationships are a core element of systems thinking. And I put this here because once we get to scripts and once we get into the nitty-gritty of what is a script, how do we use them to design group model building sessions and community-based system dynamics projects, they're all designed to amplify these tools of systems thinking within yourselves and also in collaboration with groups. So all of them are really moving us from the images on the left to the images on the right. And they're just kind of a set of organized activities, but this is kind of the core of their intention. All right, so given that these are the systems thinking tools that are important for implementing systems approaches, there are still a number of ways to do this. And this is kind of getting at that first learning objective of understanding system dynamics as one of the many tools that you could explore within a toolbox relating to systems-based approaches. So agent-based, so in any complex problem, we may see, emergent behavior, unanticipated outcomes, and policy resistance, but that may be coming from different underlying processes. So if that complexity is arising from basically the accumulation of interactions between actors or neighbors or organizations within a system, we may actually want to go with agent-based modeling. System dynamics won't necessarily be the best tool. And if that approach or that complexity is arising from a big social network or network interactions, again, that still may give rise to complexity, but would indicate a different set of system tools that we might want to pursue instead of system dynamics. System dynamics is really a optimal tool when the problem at hand and the complexity in the problem at hand is really being driven by sources of feedback, kind of these vicious cycles or virtuous cycles, kind of those who are winning keep winning, right? And it's really those kind of loops that are kind of driving the complexity rather than a network or an agent-based model. And again, I say this as a foundation that will become more relevant when we're talking about problem framing. All right. So that's kind of the basis of the motivation for systems approaches. I'm going to now step down what I think is a really useful tool for understanding what we're doing with system science or also system dynamics approaches specifically. And then I'm going to pause for questions because I do know I talk quickly. And also this is a lot of dense information that I think if you get lost early, it's hard to kind of keep that learning capability growing. So I'll pause for questions in a few slides. So in moving and kind of using system dynamics to cultivate those system tools within yourselves and in collaboration with groups, it can be useful to have this iceberg perspective in mind. And the iceberg perspective is really saying that a lot of times we start out on this journey or any journey about understanding a problem by observing events, right? We observe that obesity rates in population X are higher than we want. We observe that resources for food or water access are not as seamless as we might want in a community. But we're actually just observing these events over time. And maybe, we don't have a history of whether this has happened before, but as we kind of exist in these communities and do this work, we actually kind of get a sense of like, these aren't just events that happen in isolation. Actually, there are patterns over time. So the first dive down the iceberg that the system approach allows us or facilitates us in taking is moving from taking those events that we may experience but not have put together and starting to map out explicitly what are those patterns over time for the outcome that we're concerned about. Here's just a general example of health inequities kind of rise and fall, but aren't dropping over time. And so the status quo is here. And if my goal is here, then there's a gap between what I want and what I'm observing. And so these patterns over time can help us in starting to understand the behavior of what's going on. And once we start to understand that behavior, then we can dive even deeper down the systems iceberg to say, okay, there's a structure that's creating this behavior, right? And this first piece of the iceberg, going from events to patterns over time to structure, it's not necessarily specific to system dynamics approaches. A lot of system approaches can take us down this iceberg, but when we're actually starting to see feedback or think that our structure is driven by feedback, then the systems tools will allow us to explicitly model the actual structure that's creating the behaviors over time, that's creating the events that we're seeing in the world. Finally, systems approaches allow us to get to the lowest level of the iceberg to say, what are the actual values, attitudes, and norms, or the mental models that are driving the structure of the system, that are driving the behaviors over time. Often in problems of health equity, these mental models are around racial bias or racism, culture or social needs or social exclusion. And so really being able to say, what does, based off of the structure that's in operation, what does that say about the mental models or the beliefs about how this should work, or how this is working in our current context? And so system science tools are meant to take us down the iceberg so that we can actually get to that root mental model driving the structures and behaviors that we see. But also it allows us, and this is kind of the value of kind of flipping it for community-based system dynamics, once we understand the mental models at the root of the cause, then we can actually start to build back up from, okay, if that doesn't align with the mental models that we want to implement, how do we switch, basically build structure based off of a shifted mental model that we actually want to implement. Once we have that and build that structure, we can then start to shift to the patterns that we want to see over time. So the dotted line, and then create the events over time that we want to actually uplift and optimize rather than those we want to avoid and get rid of. All right. I'm going to pause for a moment and check the chat to see if there are any questions. Even if it's just to say, go back to slide, whatever, because I completely missed what you said. Yeah, maybe we can take 5 minutes, or no, maybe 2 minutes for a few quick clarifying questions so that we'll be able to get through stuff. Can I speak a little about how the goals, purpose of the system are related to the values, attitudes, and norms? Those can be intertwined, right? So we're going to talk about mental models in a second, and the goals and purposes of the system, maybe just the rules that are arising from the values, attitudes, and norms that are driving those goals of the system. And so it's really in kind of understanding both of those exist at that kind of lower level of the system, of the iceberg. And we can build toward, we can say we just want a different goal. Or we can say that actually we want to have that goal relate to a certain set of values, attitudes, or norms that will help us achieve that goal. So all of these kind of exist at this bottom level of the iceberg that are encompassed in mental models, which we'll talk about in a few slides. Can I explain about emergence again with an example? Yes. So when I think about, what's a good example about emergence? Let me kind of talk my way into examples. So maybe if I'm thinking about all of the, okay, a cake, because I love to bake. So a cake is not necessarily a complex system. It may just be a complicated system, but I like to think I think the heuristic of it gives my idea of emergence, right? So at the beginning of a cake, you have a set of ingredients that go together. Eggs are a different type of product than flour. Cocoa is a different type of product than, say, vanilla, right? Those are actually products that have different flavor profiles or whatnot. And we can understand those in silos. And if we were saying that a cake is just a sum of those parts, then we might come up with the idea of a very gross thing, right? Like eggs combined with chocolate combined with vanilla. And if you throw in a random flavor, right, like it may wholly sound like a gross thing if you think about each of those things siloed together and adding them together. However, when you then mix them together and add heat, which is still one element, you actually have an emergent quality of a cake that actually becomes more than just the sum of its parts, because then you have an interaction between the flavor of chocolate and the flavor of vanilla that becomes more than either of those added together, right? So that's kind of an emergent, and it's before lunch. So maybe that's why my emergent property example kind of is related to food. So that's one way that heuristic that I kind of think about when I think about emergence. Like I can't understand a cake as a sum of its pieces. I have to understand it as this emergent thing that's a different experience than just the sum of its parts. Another example might be for communities, right? All of communities are kind of individual people with different kind of goals and histories and all of that, but there's also an emergent quality of what comes out of communities when you start capacity building and organizing and whatnot, right? So there's an emergent quality that you can only understand by understanding all of the intersecting parts rather than just one piece or one stakeholder within a community. All right. Third question, and then I'm going to take a pause, and hopefully, Christopher, you can, the last question I'm going to take is Samuel Baxter's question, and then hopefully you'll accumulate the other questions, and I'll get back to them in a bit, because I do want to get through mental models. Can you give a simple distinction between agent-based modeling and system dynamics? Yes, I can. So an agent-based modeling would basically, and there's actually a few examples that I can post in the post-session notes, would say that if I want to understand neighborhood or why a certain neighborhood has a certain, I don't know, smoking rate or something like that, what I need to understand is the neighbors in the certain neighborhood, right? What their motivations are for smoking, whether they smoke or not, what their decisions around smoking are, what their job is, level of stress, all of these factors that might impact their decision rules around smoking. And then if the complexity around changing or kind of promoting smoking cessation is really just a product of the interactions between the people in the neighborhood, I can actually kind of set a set of rules around, like, if person in household X interacts with person in household Y that has a different set of, decision behaviors around smoking a number of times because they're in close proximity, right? That may change their behavior for smoking and increase their willingness to quit, right? But I can understand it as the sum of interactions that may be complex, but the sum of interactions of folks that are in a certain neighborhood, right? Now, system dynamics would say that there's actually a larger kind of feedback structure operating at a higher level. Say there's a motivation between employment and, I don't know, I'm making this up, kickbacks to the smoking lobby, right? And so because they have kickbacks to the smoking lobby then has more money to promote smoking within a certain employment group or something like that, right? And so there's actually a feedback loop that's causing endogenous behavior around smoking that is actually independent of anyone interacting within a certain neighborhood or context. So it's really kind of a difference between, like, are we looking at larger levels of feedback and kind of vicious and virtuous cycles versus, like, can we understand it by complex but rules that we can model decisions between different actors and combinations of actors within a certain system. So that's a clarification, but I can definitely give further clarification in an example after the session. All right. And Jerry, I will come. Actually, for group agreements, if we can, either Christopher or Rihanna or Michaela, can someone copy them and put them in the group chat? I think that'll be a great way to we can kind of come back to them intermittently. So we'll kind of have that there. So we'll put those group agreements in the chat. All right, thanks for the questions. Hopefully that clarified, and if it didn't, definitely kind of we'll go back to the Padlet and I can return to any questions there. All right, so now that's the systems approach, a little bit more about emergence, a little bit more about system dynamics. I did want to spend a little bit of time on mental models because I think it helps us understand what we're eliciting when we take a systems approach. so mental models are those kind of core elements that help us understand problems in complex systems. And we're going to use a lot of elephant references for the next few slides to understand mental models. So if an elephant is our reality, right, we all experience this reality in a different way. So for me, my reality of an elephant is only experienced through my perception of reality, right? Like I don't have an actual elephant next to me every single second to be like, oh, that's what an elephant is. Oh, that's what an elephant is, right? And even if I did, I have a whole host of lived experiences that shape how I understand what an elephant is. And so to make it more concrete, I'm, from North Carolina. Most of my experiences with elephants are not in the wild. Most of them are actually through the Ringling Brothers Barnum and Bailey Circus that I went to as a child. So my perception of what an elephant is greatly impacted by me experiencing that elephant in the circus setting, right? And as we can assume, that's not necessarily all the settings that elephants exist in. To take that a step further, the decisions, actions, and policies and programs put in place by Ringling Brothers Barnum and Bailey Circus impact how the elephants act, and that then in turn impacts my perception of reality. So the context that we are, the policies that drive the context of reality also shape our perceptions of reality. And mental models sit at as the kind of intersection of this perception of reality driving into our decisions and actions that then shape the experience of reality, thus either reinforcing or challenging what our perception of reality is, right? So now because of Ringling Brothers Barnum and Bailey Circus, I have a particular mental model of what an elephant is. And so when I go through the world and think about setting elephant policy, it may be strongly impacted by the previous mental models that I have, thus recreating a specific reality of what an elephant is based on that mental model. Now, that mental model also is important for understanding, is there a missing slide? Okay, no. Is also important for understanding because if I go to someone else who's never seen an elephant and I want to tell them about what an elephant is, I'm going to access that mental model. And then I'm not going to have like an elephant, again, walking around with me or kind of in with me to kind of have a clear reality of what that elephant is, but rather I'm going to have a drawing of an elephant. And that drawing of an elephant is going to be based on, again, my mental model is going to be based on what I've experienced. However, that drawing of the mental of the elephant when I'm communicating with that other person is going to reinforce that mental model as the reality of what the elephant is. So all we really communicate with others are actually that drawing of the elephant. It's really hard to actually communicate that actual reality. And so we're really navigating around, iterating around different people's drawings of elephants to understand the different mental models that are in the room. And to take it back to what we're doing with system dynamics, the systems models that we will be creating and the tools that we'll use to create these causal loop diagrams and in the more advanced settings, stock and flow diagrams are just us drawing elephants, right? So the tools first are meant to have everybody kind of draw out their perspective of an elephant. And as we see the different variations, we can start to iterate across mental models, kind of going back to the question about goals, purposes, values, and attitudes. If there's a particular mental model that we all want to work from, we can iterate toward that mental model by looking at the different drawings and creating a shared drawing of what we want to create that can then create decisions, actions, and policies that then can create the reality that we want to implement, right? So this is kind of why mental models are kind of just a little bit more about mental models and how the tools that we're going to use elicit mental models to then shape changes that we want to see at higher levels. And so system dynamics is the specific use of informal maps and formal models with computer simulation to uncover and understand endogenous sources of system behavior, which is really just to say feedback. That's all, like loops of vicious and virtuous cycles to understand system behavior. And that's what the first bullet point says. It seeks to understand feedback systems responsible for generating dynamic, so changing behavior over time. And the goal is to improve our decision making and mental models. Again, is to improve the elephant drawing that we're all working off of and create a shared elephant drawing from which we can then implement policy and action. And to bring it back to structural racism and issues of structural marginalization, I particularly think this kind of feedback perspective is at the core of it, because if we think about structural racism, it's defined as the totality of ways in which societies foster racial discrimination through mutually reinforcing and inequitable systems. And that in turn reinforce discriminatory beliefs, values, and distributions of resources, right? So even in the definition, there's this element of reinforcing, there's this element of feedback, and there's this element of accumulations over time that impact, that are driven by a set of beliefs, values, and that drive a set of distribution of resources, right? And so this is why, again, I think system dynamics is a particularly valuable tool for understanding health equity issues. And finally, mental models vary based on individuals' positionality within the system, which is also why I think system dynamics for health equity can be particularly productive. If we take an elephant, right, like, and say I didn't experience the fullness of an elephant in the circus, but rather, for some reason, I was experiencing an elephant with as a piece of a whole, right? So this is always the example of, say, 5 scientists go into a room, they have light blocking sunglasses on, and they're all positioned at different places around an elephant, but they've never seen an elephant before, and they're asked to describe an elephant. All of them are going to have a very different perspective of what an elephant is, but all of those perspectives can be correct based on where they are positioned in the system, right? Furthermore, one person can't see the whole system. And so it's only through iterating across all of these perspectives that we're then able to understand what an elephant is. Finally, for context of health inequity or health equity issues, often there's not an equal representation of whose knowledge of the system is most accessible. Oftentimes, the knowledge that's most accessible may be the person with the most privilege. And so it may be biased to saying an elephant is like a snake if that person holds the most privilege, and we really are having a misunderstood understanding of the system. And so system-based, community-based system dynamics is really getting at looking at the wholeness of the system and iterating across these perspectives. All right, so systems approaches don't automatically emphasize participation. They can still be implemented from a top-down perspective, right? I, as an expert in system dynamics, can say, I know best about creating systems models. I know something about elephants, so I'm actually going to create a systems model of an elephant, and that, you know, is the one that we should use. It doesn't necessarily say, there's not explicit kind of incorporation of systems participation in systems tools, and this risks unintentionally recreating mental models of those most privileged. And so we actually, and for problems of structural exclusion and marginalization, centering those voices of those with lived experience actually remains integral to correctly operationalizing the problem. So we actually have to explicitly incorporate participatory approaches with these systems approaches that allow us to go down the iceberg. And that's where we're kind of sitting with participatory approaches to system dynamics. Now, there are a range of approaches, but the one we're going to be focusing on today is called group model building. And it's a participatory approach for involving stakeholders in the modeling process, building shared insights, and developing consensus that will increase motivation for implementing results. And the structure of group model building is basically an iterative set of sessions that guides participants in the use of system dynamics to create a shared, what's called a dynamic hypothesis of a complex problem. And that's represented through system maps, that kind of drawing of the elephant on that we saw on the previous slides, and actual computer simulation models that operationalize that behavior over time. Now, this is the heuristic of, okay, great, I will talk a little bit quicker and hopefully people can accumulate questions in the Padlet that I'll be happy to return to. The structure of group model building project is that you'll have a session, you'll have stakeholders, again, people positioned at different points in the elephant, and you'll actually implement a set of scripts, which is the modeling tools, to facilitate shared learning and elicitation of what does a system look like. Then you'll go with your kind of modeling team and synthesize what came out of this workshop. And then you'll go back to the stakeholders to say, did we get it right? Do we need to go deeper into one piece of the system? Do we need to bring in other folks to really understand the structure of the system? So it's really an iterative approach based on modeling, which are the tools we'll use or we'll learn first. Facilitation, which is really working with others to elicit systems thinking's tools, and teamwork, where you're working with your facilitation team and the stakeholders in the session to create a learning or emergent experience of systems learning. And so to structure that, basically you could have some consistency over how do we elicit that facilitation and modeling within a group model building session when we may have different types of stakeholders. That's where we implement scripts. And scripts are basically structured facilitation activities that have well-defined inputs, clear outputs, and contribute to one group task to build shared learning in a systems-based process, right? And so we could take a set of scripts, and if we implement them at one time, and create a different system structure, we could also implement them at a different time and say that we use the same learning approach to elicit system structure. And so we can have that consistency across different group model building process. So we know that the differences that we may see in these different workshops are due to the differences in the mental model structures that we're tapping into, not in variation in how we decided to implement learning around these tasks. So community-based system dynamics is really a specific subset of group model building in which we specifically focus on power, ownership, and control of knowledge production process. So group model building doesn't necessarily have these at the core of how it operates. In fact, a lot of times it can, still operate within the information gathering or consultation elements of this graph where there's still a lot of outsider control. Community-based system dynamics is intentionally meant to switch us from this upper dotted line to this lower solid line over time, where you eventually end up at self-mobilization of the community to use these tools to actually solve problems on their own. And so it's defined as a participatory method for involving communities in the process of understanding and changing systems from endogenous perspectives of system dynamics. There really is an emphasis here on capacity building and long-term community engagement. So you could do a group model building session in one or two kind of one-off contexts, but if you're doing community-based system dynamics, it really is talking about building capacity in a community across a series of projects over time and really building that capacity. So that's one key distinction between group model building and community-based system dynamics specifically. All right, so the key features of community-based system dynamics are there's a core modeling team, which is similar to what we might think of a community advisory board, right? It's a set of lived experience experts or key stakeholders in the problem that you are trying to solve who will be brought in early to support the design of the workshop. It's also anchored in the use of group model building scripts. So that's including team facilitation, these best practices, which we'll explore in workshop 2 on Scriptopedia, and also an explicit design process that's organized and documented in a facilitation manual, again, in collaboration with the core modeling team. And again, there's this emphasis on capacity building within groups and empowering individuals in the use of systems thinking and system dynamics, and design tools. Again, that means an iterative process over time. All right, so that is participatory system dynamics, group model building, and making our way toward community-based system dynamics as a particularly useful tool for building capacity and ownership and shifting kind of power dynamics that can emerge if we're not very cognizant of them within a learning context. But where do we start with all of this? It can be kind of overwhelming. And so this is going to go back to, in order to implement these tools, we have to have a dynamic problem, right? Just because we have a great, pretty, shiny hammer doesn't mean that all of the problems that we then see are a nail. And in fact, if we're trying to hammer, say, a screw, that would be a very ineffectual process. So the biggest foundational thing that I hope you take away from these 3 sessions are that defining a dynamic problem and the tools used to define a dynamic problem are at the core of how we start out with this method. So, oh, this is just a note on the importance of this is that structure. So the structure of the system creates the behavior that we see. And so we actually have to have a clear problem in framing that so that we're not just designing for unclear outcomes, or we end up in a case where we haven't clearly defined the problem. So we actually create a structure that we don't know what it does, right? So again, that's the importance of dynamic problem framing. And the characteristics of a complex problem are that A, it has to change over time. If something doesn't change over time, then it's not a dynamic problem, and we can use all of our other tools to solve it. It does have to have time delays because action and response may be delayed in, may be kind of far apart in time. So I may implement a policy in 2000 and we may not see the full response of that policy until 2019 or 2015, right? And so there's this delay between the action and the response that makes it complex to understand how to intervene. Again, there are these feedback loops that link factors. It's history dependent, so I can only understand the current functioning of the system based on the history of the system. And there's counterintuitive behavior and policy resistance. So these are, again, keep these in mind as the core elements that define a complex problem. So to put it to an actual example, sorry, these are going to show up a little bit weird because I had to double click on them to show them. I'm going to walk through an example that I worked with on a team, and it is actually I have a video link to and a full paper relating to, so you can see it as an actual example of how this works. So we started out with this basically noticing in the news, there were a lot of articles about bias in artificial intelligence that was emerging. It was emerging in the context of imaging, it was emerging in the context of diagnosis, it was emerging in the context of different treatment perspectives and across different places in the nation. So when we were looking at these events over time, we were seeing it happening in a health system in Chicago, we were seeing it happening in a health system in California, we were seeing it happening in Boston, but at that time, they were just events that seemed to be separate things that may or may not be related to each other, right? And so the first step that we took was to accumulate these different events and kind of frame a test problem statement. So if we were to explore whether this problem is dynamic, what question might we ask that would allow us to understand whether there are patterns over time, delays over time, whether there's policy resistance in impacting the amount of racial bias that's emerging? So the question that we stated to start to explore whether this problem was dynamic was, what factors contribute to racial bias in algorithms used in healthcare and medical technologies? And so that was kind of the anchor for starting to then ask these questions, right? So in order to go from point A, the events, to point B on the iceberg, we needed to start to ask these problem framing questions to the accumulation of events that we were seeing, right? And so to do this, we basically worked with a team, or a set of community members to say, if this is dynamic over time, what are the patterns that we're either seeing in the articles or experiencing ourselves that may characterize this bias in algorithms over time? And through our kind of community engaged process, we actually did see that it was changing over time. We focused on effective treatment. So again, not just treatment, but effective treatment, and said, okay, so if this is not just events, how might this be changing over time? And what emerged was actually what mattered for this problem wasn't just one line of average change of effective treatment over time, because that kind of seemed a little bit stagnant, but rather the dynamicism emerged when we looked at the population separately. And we actually saw that there was a divergence in the proportion of the population being effectively treated for white patients, right? That was going up almost to 100%, or the goal was to go up toward 100%. Whereas for patients of color, it really was at this dynamic of stagnation and then decline in effective treatment was happening. So there actually was dynamicism once we actually framed the problem from the disparities, the inequities perspective. Whereas when we were just looking at the average change over time, we didn't necessarily see as much dynamicism. So that was the first kind of tool in, is this question a system dynamics question? Next, moving further down the systems iceberg, we wanted to say, does it involve feedback, right? And to do this, we worked with the same group to start to build quick structure, right? Like if we didn't see quick structure or there's just a lot of external factors driving those effective treatment over time, then again, maybe this isn't a dynamic process. But in the video that's linked here, you'll actually kind of explore with us how we actually started to build this feedback model actually over kind of 3 really quick sessions called rapid, I think they were called modeling sprints, similar to this, but modeling sprints to kind of see if there was feedback in the question that we wanted to pursue. And in fact, we did see that there was feedback that actually went beyond just kind of the data improvement loop that we often think about in algorithmic improvement. And it included things such as trust. It included things such as the history and memory of deaths and the accuracy of screening, right? So we actually then answered that second question, does it involve feedback? Just a pause for terminology because it'll be important. Once we had that reference mode over time and this system structure showing that there was feedback, those two things together are what's called a dynamic hypothesis. That's a theory about what structure exists to create the reference mode. And it's really those two things together that's going to drive how you then elicit mental models about a certain problem. So just wanted to star that because we'll return to that in the homeworks, as well as that'll be a terminology that comes across over time as we're working across these 3 modeling sprints. All right, so finally, we wanted to go to the lowest level of like, what value adds and what insights could be solved by taking the systems approach to understanding bias and algorithms over time. And again, we worked with our community partners to understand these particular value adds. And what we actually understood that was that because the systems approach uncovered these system structures that were beyond just optimizing the data input, prediction output kind of core structured of what algorithms do, the fact that it started to include elements of memory, of historical trauma, of trust, meant that there was actually high value in pursuing this as a dynamic problem framing and thus pursuing a community-based systems approach for exploring this problem over time. So I think that was kind of walking you through an applied example of how we then started to ask this question around like, or kind of assess whether the problem in the way that we've defined it is an actual CBSD problem. For the purposes of this project, we actually ended up stopping there, partially because we weren't able to find funding, but it really kind of elicited that if we were to go forward with this in a bigger CBSD project, digging into the trust, these kind of feedback loops around trust in medical care and treatment and memory of historical trauma was a key place where systems approach could actually uncover unforeseen or unacknowledged mental models to that point. All right. So that's all I have for now. We have about 5 minutes. We have 5 minutes. So I definitely want to uplift you all filling out the workshop survey because it'll help us kind of scope this material further and also just get feedback on what worked, what didn't work. But also if you have any 2-second questions, please feel free to put them in the chat now, and I may try to quickly answer some that I'm able to now. But again, of course, we'll at least have them documented and they can go into the Padlet for further consideration in between now and next session. Yes, you will get the slides, absolutely. So the homework is to So of course, revisit the slides, revisit the recording, but there'll be some small vignettes on problem framing. So you'll be asked to kind of like take an article in the news and start to define it dynamically. Like, what would you identify to define this problem dynamically? And then start to draw what are called behavior over time graphs, which is what that reference mode was, to start to see what variable is it that's changing over time. How does that differ between two populations for an equity issue, so that you can start to iterate around refining that problem definition. So it will be basically a worksheet of defining a problem. You'll then watch a short video on behavior over time graphs just to give you kind of the nitty gritty of how to do it. And then you'll draw some dynamic structure or some behavior over time graphs to define that problem over time, to basically create the beginnings of like that first two steps of the of problem framing, which is it dynamic, and what are the patterns over time? So that's the homework. It'll be in a worksheet that you'll get by Friday. Yes, you'll be able to get the slides. Great, 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 great. I'm glad you feel alive sometimes. I feel like system dynamic stuff can be drinking from a fire hose. So a lot of times it's a lot of information, which I'm glad that we've recorded this so that you can revisit that, unpack it, interact with different materials. And then as you're working on the homework, you can start to think about, is there a problem that you're particularly interested in from your context to start to use this tool for, that you could start to think about, how do I create a dynamic hypothesis? How would I think about behavior over time graphs? So, all right. If there are no other questions, great. This is just the final slide. It's a summary and just summarizing next steps. Just a reminder that the next session, I hope I have this right, is on October 25th. Yes, great. And that's where we'll be recapping behavior over time graphs, checking in with the homework, and then doing engaging with scripts in small groups that are meant to build these system thinking and system dynamics capabilities. All right. Well, that's all I have.
Thanks, Dr. Heaton. We so appreciate that. I learned a lot, and I work with systems dynamics myself, so this was also cool and enlightening. And like everyone said, I'm like excited to do more. So thanks for your gifts today. Here's a session, the next one, but I just wanted to say, please take the time to fill out that survey. But more importantly, we will send a follow-up email to everyone who attended today. You'll get the slides, recording, so on and so forth, and like the homework and all that good stuff. We are crafting and putting all that together right now. Are there any questions, or folks want to put things in the Padlet? There's a lot of thank yous.
I appreciate it. I also know that I talk really fast, so apologies. And again, happy to see the questions on Padlet.
No, I'm glad that we could put that together real quick. Are there any questions, things that folks want to ask, other comments? Cool. We want to close the session. I'm excited for the next one. Don't forget October 18th. We're excited. I will send out an email. Thanks everyone for coming, taking the time today. It was so cool to see. There was a lot of folks on, 53 people. So great. Super, super, super cool. Thanks for coming. Bye everyone.